Today we're going to talk about the health epidemics that we have in the United States. There are 3 or 4 of them that are great significance, and they relate to dentistry as well. First one I want to talk about is obesity. The level of obesity in the United States today is over 40%. It's actually 42%. In the year 2000, less than 25 years ago, the level of obesity was only 30%. So we have a significant increase in obesity, not only in adults, but in young people as well. The leading cause of that is changes in lifestyle, mostly diet and lack of exercise, but usually it's mostly due to diet. We're eating more simple sugars and things that aren't the best for us, things that are fast or fast food. Coupled with the obesity epidemic is also an epidemic of diabetes. We see an increase in type 2 diabetes at a level that we never saw before. Greater than 1 out of every 10 people you meet in the street is now diabetic. That, coupled with obesity, leads to another problem, and that is an increase in inflammatory markers and an increase in atherosclerotic plaques, which leads to an increase in coronary artery disease. Coronary artery disease, or heart disease, is the leading cause of death in the United States for adults. So you have those 3 things all in a significant interplay: obesity, diabetes, and coronary artery disease. Add to this another epidemic, an epidemic that's in the oral cavity. The 6th most common infection in the world is periodontal disease. And in the United States, 1 out of every 2 people has some form of periodontal disease. If you are over 60 years of age, the chances of you having periodontal disease that's not diagnosed is close to 70%. So an epidemic of periodontal disease coupled with obesity, diabetes, and heart disease, it all has an interplay. And there is a strong relationship between inflammatory markers in the mouth and inflammatory markers in the blood, which may lead to problems with atherosclerotic plaques. We find that bacteroides is found in some of the plaques that are in the blood vessels. That was found out in Sweden less than a decade ago. Maybe some of these bacteroides go through the blood-brain barrier that leads to an increase in perhaps dementia. Not completely proven, but it's thought of that it might be part of the problem. I want to quote an interesting article. It was done by Concordia, which is a large insurance company. They looked at over 60,000 of their patients, and they looked to see if they had periodontal disease, coronary artery disease, diabetes, and obesity. And they looked to see if treating the periodontal disease made any difference on the other diseases that were in their mouths. So the study was done this way. You had to have periodontal disease, and you had to have either coronary artery disease, a tendency for Alzheimer's or stroke, and diabetes. So 3 different diseases, medical diseases, plus the other medical disease of the mouth, periodontal disease. Half the group went through scaling and root planing, and the other half did not. And what they found over the year following scaling and root planing, there was a decrease in hospitalizations for diabetes, coronary artery disease, and stroke. Now, this is not the direct relationship, but they saved money when they did scaling and root planing. Which brings me to another topic. Why don't insurance companies cover scaling and root planing if there's an added benefit? Now, certainly there's an added benefit that if people get scaling and root planing and be put on a 3-month recall, this work was done by P.D. Miller and many others years ago, that they are going to keep their teeth. And the chances of them losing their teeth were close to 0. Okay, even if they had severe periodontal disease, if they went through scaling and root planing, they were put on a 3-month recall. This medical company, this insurance company, that actually does insure dental care as well, they found that there was an improvement in patients' health that saved them money. So why don't all insurance companies do that? So what's my point? My point is that by treating periodontal disease, you're going to get patients healthier, and you may actually save the insurance companies money, and you may improve their systemic health. At the very least, they won't lose as many teeth. Yet why do less than 10% of all dental insurance claims say that they're for periodontal treatment? So only 1 out of every 10 dental claims is for periodontal treatment, yet if you're 60 years of age and older, the chances of you having periodontal disease are 70%. And it really comes down to non-diagnosis and maybe patient acceptance. What I find that if I do a comprehensive examination, do a diagnosis, and show patients that they have a periodontal problem, most of them are happy to go through the periodontal treatment, which is usually scaling and root planing. You don't have to put them through exhaustive surgeries and bone grafting and laser treatment, etc., which costs thousands of dollars. For $1,500 or $2,000 at the most, you can do full mouth scaling and root planing, a comprehensive examination, and you can improve that patient's health for the rest of their life. I call it fixing the leaky roof, and I've talked about this before. I use that metaphor because a friend of mine, Danny White, happens to repair roofs. And I said, you're sort of like a dentist. If you fix the leaky roof, and he's fixed my leaky roof, what you'll do is you'll prevent the roof from falling if I just let it go, because it's just a leaky roof. Let it go. And all of a sudden, I've got to replace the roof and maybe the second floor of my house. And isn't that what happens with dental disease? It gets worse and worse slowly over time because we have the data now. We know if you brush and floss and get your teeth clean, eliminate bacteria from your mouth, you won't get decay and you won't develop periodontal disease, or you'll stop it. So why don't we do it? We've known that not only for like 5 or 10 or 15 years, we've known that since 1965. That's a long time ago. That's over 50 years ago we've known that. So why aren't we treating it? And I think the real reason that we don't treat periodontal disease to the extent that I think we should is habit. We're not in the habit of treating it. We're saying it's not that bad. And it doesn't go from 0 to 60, in just a few seconds. It's a slowly progressive disease over time. There may be bursts of activity, but usually it goes so slowly over time you don't even see it happening. Then all of a sudden, you're losing your teeth. Bob Barkley, the well-known dentist that some of you probably have never heard of, he died in 1974, said something that was a little tongue-in-cheek. And he did not treat his patients until they had excellent oral hygiene. He would charge them $10 a visit to show them how to brush and floss. Not a bad idea. Because if you have patients with good hygiene, not only are they going to get their teeth healthier and keep their teeth better, they're going to have a better value for the treatment that we perform, and they're going to go through more dental treatment that's going to be in their best interest. And what Bob Barkley said, this was his joke, is that the goal of dentistry is to make patients worse at the slowest possible rate. I'll say that again. The goal of dentistry is to make patients worse at the slowest possible rate. What did he mean by that? He meant that most patients get worse by seeing a dentist. 90% of my patients are coming to me because they've had dental care that didn't work out well. They enter my office at the age of 65 needing comprehensive treatment. They were never taught how to brush or floss, or given the information that I give them in the first 5 minutes of meeting them, that bacteria is the cause of most diseases. So if you're not doing a comprehensive examination, if you're not educating your patients, I think you may be doing them a disservice and yourself a disservice. The more my patients know about how to keep their teeth healthy, the better I am able to serve them, and actually the more dentistry they end up going through. So if you're not doing that, it's an epidemic out there. If we don't start treating it, who's going to do it? It's our responsibility, I think. I've taken that responsibility seriously to educate my patients. And I've learned that from all of my mentors, from Harold Lowe to P.D. Miller to all of the greats, Ron Nevins and many others. So it's a great opportunity out there to be the gift to our patients and to serve the people that trust us so much. Have a great day, everybody. And remember, be the gift.